Okay, so when helping a paramedic start an IV, there's gonna be 3 things that you need to grab. Primarily, an IV start kit. So open that up. That's the first thing you'll do. First thing you'll grab, first thing you'll do. Open this up. There's a bunch of stuff in here. Try not to get it everywhere. The first thing that they are going to need out of this is a tourniquet. So you'll take the small rubber band off of here, open it up like that. The paramedic will take this, put it on the patient's arm, and start looking for a vein that they can start the IV on. The next thing that they're gonna need is an alcohol prep that you will open and hand to them, like so. They're gonna use that to clean the patient's arm wherever they're starting the IV. So once they've established a vein that looks good and they want to try to get an IV there, the next thing that they're going to need is a catheter. Some people call them catheters, some people call them needles. Technically they're catheters. Catheters come in a bunch of different sizes. A higher number means a smaller needle. So from 24 all the way down to 14. So 14 is going to be your biggest, 24 is going to be your smallest. So obviously a 24 is like for babies, a 22 is like for old people. 14s, honestly, you don't really need 14s ever. It's kind of mean. You need a 16 or an 18 gauge needle for a trauma so that you can flow a lot of fluids through there quickly. The most common sizes that you will need for the typical patient are 18 gauge and 20 gauge. All these different gauges are going to be denoted by colors. So they're going to look, I have like a kind of a spectrum here for you to see. There's a lot of different types of like brands of needles, but they're all going to use these same colors, okay? So here I have a 22, which is the smallest. A 20 is pink. A 18 is green. So those are the 2 that you should always grab when someone's about to start an IV. You should grab an 18 gauge and a 20 gauge needle and have that ready. Just for you guys to see. So if you can see in there, that's the needle for a 22 gauge, which is pretty small, versus a 16, which is for a trauma, okay? So you can get fluids through that big fat needle a lot faster, through that big fat catheter, excuse me, a lot faster than you can with those little ones. So that's why you need a bigger gauge for a trauma when they need fluid resuscitation. Anyway, all you're gonna do is have an 18 and a 20 ready. Whenever your medic is ready, they'll tell you if they want an 18 or a 20, don't assume. They'll tell you, all you're gonna do is open it up. What I do is I hold it by the cap so that when my medic grabs it, they grab just the needle. I would not suggest doing this when you're brand new because sometimes, say the medic pulls it out, okay, now it's just a needle, and if you guys bump into each other the wrong way, they're gonna stab you in the arm or in the hand and it's not gonna feel good. So, also never ever recap your needles. I know you just watched me do it, but never ever do it. So just, they will take the whole thing out of the package and they will uncap it themselves, okay? Once they're done, when they place the IV, the plastic catheter stays in. The metal needle that you see here comes, let me see if I can show you guys. There's 2 parts. Can you see the plastic part coming off? I know it's focused on my face. See the plastic part coming off? That's the part that stays in the patient's arm. It's soft. The needle comes back out, and that needs to go in a sharps container, especially at that time because it's contaminated with the patient's blood. Gross. Don't get Hep C. Okay? Okay. While they're doing that, while they're looking for the vein, you should be setting up what they call sometimes a Hep lock. It's not technically a Hep lock. A saline lock or an extension set, okay? There's 2 parts that you're gonna need for that. A saline flush, and this is the lock itself, okay? These come in different kind of packages, so you'll just have to know what your ambo uses. So you're gonna open up both of those. This just has a little paper on it. saline flush has a little cap on it. You'll twist that off. Try not to touch the tip. I like to draw backward and then push forward till a little bit of saline comes out. Oh, here's my dog. Hey, bud. Yeah. All right, then you are going to twist this, come on, onto this end, okay? And it's gonna twist right on. You kind of have to push it a little bit, okay? Then, because you've already primed it, the saline flush, now you need to prime the tubing and get all the air out of the tubing. So you're just gonna push up on this. I'll see if you can see it. Can you see it fill in? Okay, and I like to do it just until a few drops drip out the end, like that. Okay, then you're gonna have this ready because as soon as the paramedic gets a flash of blood and they have venous access, they are going to want to screw this end onto the catheter that's sticking out of the patient. So when they have the vein established and they ask you to, you will hand them this end, and before you do that, you're going to take off this cap. It just screws right off. Okay, apparently I'm really weak. Screws right off. This end, we're in the field, so nothing's truly sterile, but we want to keep this as clean as possible, okay? So once this cap is off, don't let this touch the bench or your gloves or the patient's skin, anything like that, okay? This is gonna go right onto the catheter that's sticking out of the patient's arm. And then the medic will, again, flush it to make sure that it's going into the vein and it's not blown. Okay, so this is now attached to the patient. The last things that the paramedic's gonna need from you are back in this start kit, okay? So back in this start kit, this is called, some people call it an offsite, some people call it Tegaderm, whatever your medic calls it, that's what they're gonna need next. So this is like the tape that holds the IV in place, right? So all you're gonna do is take the sticker off the back, and this is now super sticky. Hand it to your medic with the sticky side down. Just grab it from like these ends, okay? So the medic will stick that on the patient arm. And then because they used that offsite, or because they used the saline lock and there's kind of a lot of extra tubing hanging out, most of the times the medic will use this little bit of tape that comes in the start kit just to like doubly secure it, so you can hand it to them like that. Also, on the off chance your medic misses their IV and the patient's bleeding a little bit, they're gonna pull that catheter back out, and there will be some like little 2x2 gauzes inside the start kit, so you can hand that to your medic to control the bleeding, okay?